Good morning. This is Sherri Hammack, and I am the coordinator for the National Building Bridges Initiative. And this is a BBI webinar for building outcome-driven cultures of care. And I am joined with Laura Heintz and Ebony Chambers, who will speak momentarily. But I just wanted to do a few housekeeping things and give you a little backdrop of BBI, which is Building Bridges Initiative. So there is a chat box that you can type in your questions, and we can address those for sure at the end or along the way possibly. And also on the lower left side, there are a couple of handouts that you can download, and one being the PowerPoint presentation, so you can have that available to you later. So with that, I wanted to go ahead and launch into the presentation and give you the framework. This is BBI's definition or mission, and BBI provides a framework that really promotes partnerships and collaborations, and that's really kind of across the board, whether it's with families and youth, community and residentially based, and along with service providers and policy makers and advocates. And they're listed: family-driven, youth-guided, strength-based, culturally and linguistically competent are the core values within that framework, and very much aligned with some of the federally supported system of care work that is going on. But BBI's mission is really to help provide guidance and technical assistance and bring the best research-based ideas and strategies and practices with relationship to residential intervention, and with an eye of looking at outcomes post-discharge to residential intervention. So it's not enough that a young person may be doing well within a residential setting, but how does that translate to their home and family and community? And so that is the mission of BBI. We have very many partners, and here you'll see a few that we work with when we're developing training or technical assistance and guidance documents. That these are the partners we work with, and I'll just say this, is that we work very much in tandem with family representatives or families who have had lived experiences in residential intervention, as well as youth that have those experiences too. So all the products that you see coming out of BBI have been developed with those kinds of partnerships. If you want to learn more about BBI, there is a joint resolution document that is available at the website that you see here on this slide. And if you're a provider program that includes residential intervention, and you like what you see and you feel like you can buy into this framework, then please email Dr. Blau, Gary Blau, who's the branch director at SAMHSA, the Substance Abuse Mental Health Services Administration, as well as Beth Caldwell or myself, and request to be put on the partners list with the joint resolution, and then you can be put on a BBI distribution list to be recipients of newly developed documents and be invited to BBI events. I'll just point you to some other guidance documents and articles that are posted on the BBI website, and if you want to learn more about this and about best practices, you can go to the website address and go to products on the tab, and then over to tools, and you'll find these briefing documents listed that can help inform you. And I wanted to point to this one that has been recently churned out that's on really looking at short-term residential interventions and some of the programs across the country that have been doing this work. That's an excellent guide that I would say look at this as one of your top ones first. If you're interested in getting continuing education units or CEUs, you can go to this link that's supported by the University of Maryland and learn about BBI and earn CEUs along with that. So there is a list and a link and a resource for that capability. There's also a book on best practices guide in residential that was developed in 2014 that is available, as well as a new book that's in the making that's updating more of these strategies and practices based on best practices and the research today. So keep an eye out for that, and we'll certainly let you know if you're on our distribution list about that. I wanted to just point to this newest article, one of the new articles around multidimensional family therapy in a study with residential treatment. And given MDFT, they showed that they were able to maintain treatment gains with this modality more than youth in residential treatment. And so I think that the point of really looking at residential intervention, if you have those supports in the community to do MDFT and the supports to do that to fidelity. But residential treatment continues to be a need, and we just want to be purposeful and thoughtful about how that is accessed and that it's a part of the continuum of care. This framework and some of these best practices fold into some of the future of what's going on. There was legislation recently passed around Family First Prevention Services Act, and I'm not going to get into a lot of the tenets of this, but I will just say that Family First is using Title IV dollars differently, and there's a component in this piece of legislation with regards to residential treatment and QRTPs, Qualified Residential Treatment Programs. And I know many states are looking at this and whether they're going to opt in or not. And this law is taking some of those best practices and folding it in with the structure of this, and especially with an eye towards prevention services and other settings, other eligible settings for to support and divert youth going into foster family homes. So here are some of those elements with that particular piece of legislation, and I'll just let you read through that. Here are resources about that, including the actual law itself, as well as summaries and cliff notes that you can find about Family First. And there continues to be more guidance coming down from the Federal Bureau too about this piece of legislation. But the point being that this law is really aligning with some of the core principles that are listed here on this slide with Building Bridges initiative. So if you learn about the Building Bridges framework, you'll be in line with what's coming down the pike. With regards to this particular webinar on building outcome-driven cultures of care, I wanted to point to a fairly recent post-residential outcomes pilot survey that's available on the front page of our website as well. And this is really intended for use by staff of residential treatment providers, and it's with regards to interviews of caregivers of youth that have been previously discharged. It would help these programs determine, what was going on and what was helpful, with the services that they provided, and how that translated to post-discharge, and help them inform implementation of best practice. So I would just call your attention to that as we start talking about outcomes, and let you know that this is all of our contact information for BBI, and we're available to help fill in any of the gaps as you're looking through some of these materials. And if you're interested, you can contact us. And at this time, I'm going to turn it over to Laura and Ebony and just let you know that they are experts that have been doing this transformative work for a very long time. And we're excited to have them as part of our expert exchange network, and especially with this particular topic. So I'll let Laura and Ebony give you more background about who they are and their organization. So I'll turn it on over to Laura.
Hi, welcome. It's a pleasure to be here. I'm Dr. Laura Heintz. I'm the CEO of Stanford Youth Solutions, and with me is Ebony Chambers. She's our Family and Youth Partnership Director. We're going to do a brief intro, and then dive into our presentation. Stanford Youth Solutions actually was founded in 1900 as an orphanage here Sacramento, California. And over the years, we've done a lot of transformational redesigns of what we do based on the needs of the community and also based on research that we have done ourselves and research out there in the world. Personally, this is a piece of outcome-driven culture that we're going to highlight is the family-centered practice component. It is actually critically important to deliver on your outcomes if you're working with families, because that's why they come to us. And within my own family, we experienced a lot of challenges early on. I have some adopted siblings, and my parents welcomed in other children that were struggling in their own family systems. So on a personal note, it's very important to me. And I'm going to hand that over to Ebony so she can share a little bit about her story.
Hi, everyone. My name is Ebony Chambers, and I'm excited to be here to present with Laura. I, as Director of Family and Youth Partnership, provide oversight for our youth advocates and our family partners. Our entire team all has lived experience navigating either through the child welfare, mental health, or juvenile justice systems. I'm a mom of 4. My oldest is adopted. She's an adult now, but we navigated through a number of mental health services for her. She was also placed in residential treatment to help her and our entire family address a lot of her mental health needs. And it was a very challenging and isolating experience. And so as we were able to, in the end, navigate through that pretty successfully towards the end there and help to increase her emotional well-being and our family's emotional well-being, really, the need for systems to come together and to really look at outcomes and ensure that families are successful and have that embedded in their culture is something that I'm really passionate about. So I will, as it comes up, share some of those experiences and be here with you all today.
So our learning objectives today are really identifying some key elements of an outcome-driven culture and review an example of embedding that outcome-driven culture into an organization. And you can actually utilize those examples in any program, any service delivery model that you have. It is not specific to any one program model. So that's one key highlight I want to make sure to keep in mind as we go through this. And then for you to have an opportunity to reflect on your own existing processes within your own organization and identify what's working and where you want to make some improvements.
So Laura mentioned a bit about our journey in starting off as an orphanage. And through the years, our evolution really moved from residential as really the only, as a placement option, but really a primary placement option, to moving residential as a short-term treatment option with collaboration with families, ensuring that we were looking at all the options to get them home quickly and establish stability for the families. We also had a history of really being child and youth-centered. The focus was on the child, and then we found as those children were going home, the families were not stabilized, and the youth ended up back into care. And so we really shifted our focus to be centered around the entire family and looking at all of the dynamics so that we could truly serve the family and decrease recidivism. We didn't want them coming back into our system of care. We wanted to heal the whole family in a holistic approach. We looked at behavior modification as our primary intervention and really moved to increasing our trauma-informed evidence-based practices. And so we moved into offering trauma-focused cognitive behavioral therapy, PCIT, so parent-child interaction therapy, as well as functional family therapy. We now offer seeking safety to support youth that have been sexually exploited. And then we also have the Q-centered treatment therapy, which is a collaboration with Stanford University, where we're testing that model against trauma-focused CBT. So we really have opened up the opportunity to offer a number of evidence-based practices to meet all of the unique needs of our youth and families. We also had a strong reliance on staff resources as the primary intervention, and that evolution then included really maximizing our families and community supports, because we know that at the end of the day, that's where they will be, and we needed to strengthen those resources and not have our staff be the primary source of intervention for our youth.
So when we're working through our organization, one of the things, and our transformation, we really had to reflect on why we do the work we do. And I don't know if you're familiar with the book called Start With Why from Simon Sinek, but it is very helpful in inspiring transformational change in an organization and overall attracting people to your organization that really share that same purpose, that why. So we had to reflect on our own why within our organization, which goes beyond the mission. It goes into, obviously our mission is inspiring sustainable change for young people and their families and to empower them to overcome serious challenges together. But really, what was our why? Why would we be focused on this mission? And the mission is really the how to do or execute our why. And ultimately, as we looked into our own purpose for existing as an organization, what we came to is that all youth have a right to a lifelong connection that supports them into adulthood, so that they can thrive. So it is really about belonging and ensuring that every young person we serve has a sense of belonging and connection. Once you know your why, it becomes easier to really understand where you need to go as far as your path. One of the things we did also is really took a look at our own outcomes. This, when I referenced the fact that we did our own research and we also looked at where things were going across the nation, we actually took a look at how we were doing in our group homes and how we were doing in one of our community-based programs. At that time, we had wraparound, which we continue to have, but we looked at our wraparound program in comparison to our group home outcomes. We use the Child Adolescent Functional Assessment Scale, which really looks at 10 domains of functioning for a young person, 8 of which are their personal navigation of life, and 2 which are focused on their family support and family relationships. So with that, you can look at, we have this gray point. This is our group home stats or data at intake at 101, and overall this is an average score, and at discharge at 92.5. Not a significant change. That could be just some, well, we were kind of disheartened about it, to tell you the truth, because we were spending a lot of money on our group home programs and not seeing much as a way of change. And then in our wraparound program, yes, we started at 80.6, which is a little lower than 101, right? But we saw a much more significant change at discharge over the time. One of the things to also point out is, remember, the 2 domains are family support, family functioning. So all of our wraparound youth were going into family. It may be their own family, and it may have been a family identified like a foster family or potentially even an adoptive family. But that can change the score slightly, enough to where you're really looking at the same kids, because our wraparound kids are all transitioning from group home programs. So with that, and the fact that we were losing significant money, which I will kind of show you our cost comparisons. Now in 2005-06, we were running the group homes, and we were getting reimbursed by the state at $5,600 a month, when the actual costs were more like $7,500 a month. So we were actually losing over $600,000 a year, which was pretty troubling, and that was a concern of our board membership. We fast forward that to even in 2014, our costs in all of our other programming, because we have multiple programs now. Our outpatient is about $1,000, which is our mental health program. Therapeutic behavioral services is a little over $2,000. WRAP is combined, wraparound with the RCL dollars is about $3,400, not even close to that $7,500 cost. And then our most expensive is our intensive treatment, foster care, at that point, $4,800. That's gone up a little bit since then, but that's just a snapshot that all of these other programs cost significantly less than our group homes. And we also knew that any of our community-based mental health programs and supports were doing better with our young people. So here's an example of our cost of care now in California. Obviously, they may look like sticker shock to somebody in another part of the country, but our STRTP costs, because it's short-term residential treatment, is now near $13,000 a month. So there's a real motivation to get the children out of a residential treatment program and back into programs out in the community, where they actually are connected to the families and to their broader community. With all of this, there was a lot of conversation about changing our focus to permanency. That is our why of having every young person with family, lifelong connections, a sense of belonging. So we had to do a real culture shift, having been an orphanage since 1900, and we had a mindset of really rescuing children from families, and changing that culture to a really family-centered, strength-based culture, and understanding that every young person is going to find family, whether we help them or not, some way or another, before we end services or after. So we really need to be engaged in that focus. And so we had to involve all the staff, really getting staff engaged in that conversation, understanding that youth do better, all people do better when they have a sense of belonging and family, and that we also had to involve our board members as champions for change. So they had to understand the information, like presenting the data, the cost data, but also the outcome data. And we had to also educate and engage our partners in the community, including our funders. We actually were focused on leading the change here. California is in even a broader initiative now, but we planted the seed in 2005 for the change across the state. And then we had to recruit and hire and train those who also valued our community-based services and a sense of the family-centered practice. What has resulted is better outcomes for young people, improved morale, and reduced workers' comp claims, and also greater fiscal strength. I do see some questions coming up. We can talk a little bit about how we're working with children in foster care. I'll actually briefly mention that. Ebony can chime in on that one. We have an intensive treatment foster care. It's now called intensive services foster care, where those youth who would otherwise be in group homes are placed with highly skilled families, typically families or caregivers who have been in the field or education, or they've actually nurses are amazing, especially retired nurses are amazingly effective in the work of providing intensive services foster care home. They are paid at a higher rate. That's why you notice that the rate was higher for ISFC or intensive services. They're compensated at a higher rate because many of them cannot actually do other jobs, or they have to cut their work hours to support our youth. We have a family support counselor that is supports the family. We also have a youth advocate and family partnership involved. We also do something called family search and engagement, and I'll hand that over to Ebony.
So our family and youth partnership team leads locating families to work with, and really it is in alignment with our outcomes-driven culture, as we know that to be able to serve the whole family, we need to have the families present. And so our family and youth partnership team, the family advocates and family partners, initiate the beginning of the searching for the families and the initial outreach, because we know that oftentimes when we're first starting to locate families, there is some, at times, difficulty with engagement, and having partners that have lived experience be able to do that initial outreach, who understand what it might feel like to receive a call saying that you've got a youth that's in care and is struggling and really could use your additional support, really helps with the engagement piece, so that our families feel more supported. And then we do a warm handoff and collaboration with the foster care team and our other teams. We work with all teams to do the family finding in that regard.
So our own culture shift, we did face resistance. We had some staff who did leave through the process of really focusing more on the family-centered process as opposed to rescuing a child, right? And we understand that all change is scary. Even good change is scary. So there's another resource that I would recommend, and it's called Managing Transitions by William Bridges. I utilize this a lot in all of our change that we do here. One is that you really communicate the vision. That's why you have to really understand your why and really do some soul searching. You know, even in this time as you're sitting here, what is your why? Not only within the organization, but resonates for you of why you continue to do the work you do. And just jot that down and see, you know, do that exercise with your own staff to see where everybody is and where they could come into alignment. And then from that why, you map out a plan together. So you support the team by actually having them involved in mapping out how you do the change, how you move from youth-centered to family-centered, how you move from, okay, we're going to have a young person stay in our residential treatment program for a very long time so that they can build skills, et cetera, and transition that thought process into how do we get them stabilized and move back out into a community, back out into a family where they can build skills there. And then you identify those early adapters. You're going to find some people are right on board. Maybe they had their own lived experience and they get that resonates with them, understanding that that family is really important to every young person, every person. And then you're going to have resistors who basically have maybe worked in group homes a long time, have anecdotal stories of basically rescuing those children that don't want to leave the program because they're afraid or they don't want to get rejected from a family. both the early adapters and resistors are critical in your change. You want to activate both of them, or both key people or key groups. And through that, have some brainstorming with them on how do we get to this next place. And you will find your champions, and you can also convert others into champions. And some of our strongest resistors became our greatest champions in our work. But again, we have to go to that why, which is our purpose statement, which is deeper than the mission. The mission's really about how. So the why is your vision. What is your cause? What do you believe in? And then that how is how you get there, the process or actions taken. And then ultimately that what is our result. And that's where we're talking about outcomes. The reason the why is so important is it's actually an emotional response. And we know that emotion is very powerful in human beings. It is how we activate. It is our motivator. Often it is hard to verbalize that why. So putting it to some words that actually resonate emotionally for you is really important. And the reason that it's actually hard to verbalize is it's actually in the limbic system of the brain, that emotional response. And so when you actually feel it, that emotion that resonates with what you state as your purpose, you know you found your why. And from there, you can activate, you can motivate, and you actually can move mountains once you have a common why within the organization. Our leaders, those on the phone, those listening right now, you are the leaders, and you drive the change. At every level of the organization, you're going to identify leaders who are resonating with that why. It doesn't just mean the CEO or the board. It means at all levels of the organization. And to constantly communicate that why. With that, you identify your champions. You get commitment at all levels, folks that really resonate with the why. And you then figure out a regular evaluation process of what's working, what's leading you to your why, and what's not through that data review process. That's why data usage and the way you use your data is so important, why I've attached that resource to this presentation. Another component is taking action. Now, one of the big things we focus on in our organization is that we're a learning organization. So we will take action even if we don't know all the answers. If it is leading us to our why, we will take action, and then we can correct along the way. So not being afraid of taking action is a critical component of that change process. And ultimately, like I said at the very beginning, results do matter. That is why the children come through our doors. That's why families need our help, is they want a change. So if we aren't getting results, if we aren't finding a significant change in the work we do from intake to discharge, we need to do something differently, and actually post-discharge also, because ultimately we're really focused on permanency and long-term stability for our young people. I've included a little sketch that gives you an example of how we live outcomes-driven culture here at Stanford. Ultimately, we have our vision, which is our why, at the very top of the diagram. Our mission is the how. And then we've got lots of things we do, a lot of active action items. We have consultation, we have evaluation, we have training and administration. One thing I want to note on our administrative services is it is built into our administration that we are here to serve the direct care staff. We're delivering the work with our youth and our families. So our focus is streamlining as much as possible, giving them the tools they need, supporting them in their own success, and hearing from them, just like we need to hear from our families, our young people, hearing from them when we need to improve a process, improve a system, provide a new tool. So our focus is really supporting the folks that are at the direct service line. I'm going to talk a little bit about our strategic plan pillars. You will see them here. Our strategic plan pillars are services, our people, infrastructure, and impact. In each of these, the services is all of our modalities of service delivery and making them the best they can be. But we talk about evidence-based practices, but also ensuring we look at our outcome data in relationship to our service delivery. And with that, each one of our staff has an employee development plan, and they have their own outcomes, their own activities, and their own measures that actually are fed up into the program or department, fed into the annual operating plan, which is then driven up into the strategic plan. Everybody in the organization knows the strategic plan and the pillars and how they fit into manifesting or executing our strategic plan. We do that through consultation, regular consultation. It is weekly and biweekly, depending on how long the staff has been here, how they're performing, etc. And if we've got some key initiative, we may increase our consultation. Our people, we really invest in the staff within the organization, and also we consider our volunteers, our families, a part of our voice of our people, and our board members is critically important. And one thing I do want to note is that even our board members have outcome measures that are in the strategic plan. And then our infrastructure, I mean, that is critically important with the work we do. We have several priorities. Actually, that is our deepest component of the strategic plan, because you have to have infrastructure to support the staff in delivering their services. And, you know, the financial well-being, but also making sure we're up to date on our tools that we're providing for our staff, making sure that we're actually responding to the needs of the community. And then impact is, again, about our results. Results matter at services, they matter at people, they matter at infrastructure, but our impact is how are we driving change within our broader organization, and how, and so that is actually a critical component, our advocacy, how our partnership with Stanford University is driving the practice in trauma-informed treatment. So we have consultation. We also have evaluation built in, and we may talk about that a little bit further, and how that is both at an individual component, but also at program and departments organization. And then we do a lot of training. Our onboarding training is very comprehensive about our mission, our vision, our values. We start with that why of our purpose of every young person has a lifelong permanent connection to family. And then we provide new skills and a lot of training along the way. It is a huge investment for us to do this work, and it is a constant learning process. And then you'll see our foundational values at the bottom of the diagram, which, of course, accountability is critically important, as are all of the other components, and partnership not only within the organization, but with our families, our young people, and the stakeholders. And then empowerment, which all of this is critically important, but some of the things we highlight are accountability and partnership and empowerment. And ensuring integrity is ensuring we do what we say we're going to do in our work. We have our 3 core pathways. I've already talked about the mission, vision, values. They guide every decision we make in the organization. And then I referenced OAMs. Those are outcomes, activities, and measures. And then we also have recognition and celebration, which reinforces the work we do. We clearly define our process metrics to achieve outcomes, and that is really defined annually, what we specifically need to deliver in each of our programs and what each staff is responsible for. We have an ongoing process of feedback and review. We really emphasize honest analysis of improvement, which I want to highlight our developmental phases of using outcome data. We provide opportunities for learning throughout the organization. We have committees that are involved in giving the executive team feedback so that we can move forward in the work we do. I'm going to hand this over to Ebony on family-centered practice.
So our family-centered practice principles really started in our wraparound program, and we formally adopted them as a whole agency practice. And really when we think about kind of what's raining here in California now, but when it's raining and we're experiencing challenges, that family-centered practice embedded into all of our culture and considering outcomes really helps us to dive into the challenges and look at each practice principle to ensure that we are being mindful of those and problem solving using each one of the ones here.
So the key elements of an outcome-driven culture that we've identified are making sure we hire and train folks, but hiring the right folks that resonate with our why, and then training them, equipping them to do the work. Our outcomes, activities, and measures for everything, from our committees to our individual staff to our programs departments to our annual operating plan up into the strategic plan. We do offer merit-based pay based on performance at an individual level. So we have an objective process to measure outcomes within our organization, and then we are committed to, even if it's small, a merit-based pay for our staff annually. We have to have accessibility to data in order to basically measure our merit, our effectiveness in achieving our outcomes. And then we do a lot. We embed a recognition and celebration in every part, from every meeting, starting with what's working to more formal recognition across the organization. We will go through these things relatively quickly.
So we know that to achieve those outcomes, we have to be able to hire the right people that have a values alignment with us. And so we have to ensure that we're implementing some critical pieces to ensuring that we're hiring those right folks. And so let me see here. So to do that, we actually have a multi-step interview process, and we have a first and second. First one is really ensuring that values alignment. We ask questions such as what are their values and how they implement them into the work that they do and in their own lives. And then the next step, if we feel that there's that value alignment there, we move them into a role play that actually includes a family partner and a youth advocate. They are role playing as if they're entering a family's home, and we're looking to see if they're utilizing the values that they talk about and really engaging. And our family partners and youth advocates are there to see how does it feel as a young person, and what is that experience as a parent? Are they navigating and talking with both of them, and so the team then comes together and makes that decision that includes human resources to decide if it's a good fit and brings them on with the organization. But we know, again, that hiring the right people contributes to better results for youth and families. If there is not a value alignment, we find that the staff that are brought on exit pretty quickly, and we also know that impacts outcomes as multiple transitions and changes is hard for our youth and families. Our managers and leaders really spend a lot of time on employee development. It's something that we place a high value in regard to, in that we take a strong interest not only in the execution of their daily duties, but in their growth and the development of the person in general.
So we have, as I mentioned, outcomes at every level, outcomes, activities, measures, from the employee development plans up through the program departments, and up through the annual operating plan through the strategic plan. Here is an example of a logic model that we have a logic model for every program, every service delivery model we have. We actually start with a logic model when we design a new program or make any modifications to an existing program. And we identify, this is just a sample of identifying who's involved. You will notice that youth and family advocacy is embedded in every one of our programs, but here's an example of that. And then our short-term, our medium-term, and long-term objectives.
So we always use the SMART goals when we're developing our outcomes, activities, and measurements. We want to make sure that as we're looking at what we want to achieve, that it's clearly defined, not just for the leadership, but for the staff that need to, that are a part of the execution of the goals, that it's measurable. We run our year July 1 to June 30th, and so we're mindful of those quarterly measurements so that we can ensure we're staying on track, and we have a way that we come back to our executive leadership to share how we're doing and get feedback, but we want to be able to measure it, make sure that it's achievable. If we can stretch, and we want to stretch, we do, but we also don't want to stretch so far that it doesn't feel achievable for our teams. And then, of course, keeping it focused on results and have that completion date set so that everyone is aware of how they'll be able to execute it in the time needed to do so. This is just an example of actually one of our outcomes. This is our wraparound program, and you'll see that's really those activities and measurements part. So one of them is that employees will provide families and system partners with strong feedback for discharge planning, and the measurement for that is that 72% of youth will experience a positive discharge from wraparound, and that positive discharge is defined that they'll be home with families, living in a family-based setting, or independently living and connected with family. And then you'll see that we do those quarterly updates, so September, December, March, and then at the end of June, and they were on track, and then at the end of the year actually consistently exceeded.
So with that, when they exceed or meet or exceed their goals, they do qualify for merit-based pay, which is the reason we actually kept this in place. And I know it's strange or odd for many nonprofits, but our staff expressed through our engagement survey that they wanted some sort of recognition for achieving or exceeding their objectives, which are not always easy to achieve. So we've kept that in and committed to it no matter what annually. With that, we have to have a way to measure our performance. And through that, we invested in a tool. And I will give you an example of that tool. Right here, we have, and it is the wraparound program again, where this staff person consistently exceeded 27 of the 30 youth had positive discharges. And with that, if all of the outcomes for this staff person are met or exceeds, they qualify. It varies what they qualify for, but a certain percentage of merit-based pay. We right now can only afford up to a 3%. So some people get a 1%. Some people don't get any percentage, which is then they are motivated to, they get a little disheartened, but motivated to achieve their objectives next time. We also check in on a regular basis in consult to keep folks on track. This is why data accessibility is so critically important. And I did give you the developmental phases of using outcome data as a resource. Some of the things to look at, one of the things we ran into a long time ago was we would argue about our data. We had some confusion of, from research to our quality department. So we actually combined our quality assurance and our research department into one department, quality improvement and research. We invested in ensuring that our data was accurate. We also invested in an electronic health record. It took us 5 years to actually build the electronic health record to what we wanted so that we could have the data at our fingertips. And we communicate that data on a regular basis at all levels of the organization. And in a program departments, they review the data with our research representatives who are outside of the department, and they have conversations about what's working, what's not working, and how they can improve their service delivery on a regular basis. This is at every level of our organization. What is critically important in all of this is that you really have to define what you want to measure. What is the most important thing in your mission? And again, let's go back to your why. For us, it's our permanency data and improved outcomes, overall long-term functioning of a young person. And then what infrastructure do you currently have and what do you need to build in? And an example is our electronic health record. It is important for you at every level of the organization to look at your data. And that's why, again, look at where you are on your developmental phases from the worksheet or the resource we attached. And talk about the real benefits, even knowing, I report out to my board when we're not meeting our outcomes. And we have a discussion at that level. And it's actually been particularly helpful. The board's been able to bring additional resources and brainstorm with me on things to try to, enact. One of those is we built in an intern program from our local universities so that the staff understand the work before they actually are hired on. And then we actually find even more staff that are committed to that why that we're here. Again, taking action is critically important. So based on what you have in your data, you need to define an action plan and how to get to that next step. And here is an opportunity for some self-reflection. Have these questions, and there's also additional questions or data or points in our developmental phases of using outcome data worksheet.
So, we've moved through a lot of the how and the why, but we also have to make sure that we're also celebrating when we are meeting those outcomes and when we are, the teams are really working hard to achieve success on behalf of youth and with youth and families. And so we have a formal process for doing that. We have a formal area of recognition. It's actually a sheet that allows us to fill in. There's questions on there like, how was it in alignment with our values? What principles did they carry out in regards to family-centered practices? But we also have ways to do that through personal notes, what's workings, and emails, and we just let those fly. We really want to make sure that it's embedded in our culture. We also have opportunities for that to be embedded in our consultation, as well as those merit-based increases that Laura discussed.
So recognition and celebration, we're so committed to this that we have a committee. So membership is open to all staff at all levels. The chair cannot be a director. It has to be somebody that's either a direct care staff or mid-level management. And they coordinate all activities and events, and they have, as does every committee we have, their own outcomes, activities, and measures that are built into the annual operating plan.
We also have a formal recognition policy as well, and then we have a chief forum trainings that actually highlight how to recognize others and what that looks like in practice. And then it's also embedded into our employee development plan. So our consults, again, start off with what's working, but when we are reviewing their year, there is also a space for us to be able to acknowledge and highlight all areas that they've excelled in, and some of that's not always captured in that in the outcomes, activities, and measurements, and so we have that special place to add more information around that. And then we have a celebration calendar where we have monthly celebration of employees' anniversaries and birthdays, as well as employee recognition dinner, and just lots of fun activities to really engage our teams and let them know that we value the work that they do.
So one of the things we'd like you to do is just reflect on a recent accomplishment within your organization or yourself, what's happened with you, and who knew about it, how were those involved recognized, and who recognized them, and is there anything you could do differently next time? We put in this gold star because one of the funny things that I do just sort of spontaneously is when I notice something happening and somebody does something pretty cool through the organization, I'll say a gold star for you and just give them a gold star right then and there. So it's just a fun thing and obviously not very expensive. So we'd like you to reflect on where you are now as far as a learning organization and also as far as where you are on your results and outcomes driven culture. And where would you like to be? And you can actually take a look at that developmental phases of data to help you in that, and then even those key points of an outcome-driven culture that we've reviewed. And then just what is that first step you can take? What resources do you need? Who do you want on board or need on board? And how do you then motivate? And then continue to repeat this all along your journey because honestly, it never ends. You continue to do this work over and over if you truly want to live as an outcomes-driven culture. Here's our references that I referred to through the presentation. And our contact information as we've gone through the presentation pretty quickly.
Thank you, Laura and Ebony. This is Sherri again, and I'll just invite folks to write any questions in the chat box, and we can certainly address those. I had a question about how you have included family voice in the development of various outcomes. Could you speak a little bit more about that, either Laura or Ebony?
Sure. So our family partners and youth advocates are a part of all of the teams, and so every year as we look at practice improvement, feedback from families, we actually have parent and youth panels that gather feedback, and a part of that also helps us drive the outcomes that we decide on for the year. But our family partners and youth advocates meet with every leadership team. So take wraparound as an example. The family partner and the youth advocate meet with the wraparound director as well as the wraparound clinical program managers, and as they're developing the outcomes for the year, family and youth voice is integrated into the development of those outcomes, and they're a part of the strategies and interventions that are also being implemented. They're also can be utilized as a part of observation. So as our teams are out in the field, our family partners and youth advocates also provide a valuable layer of feedback in regards to engagement and how those strategies and interventions are actually being executed and successful. And they meet with the management teams depending on the program, either weekly or biweekly, to offer feedback on how that's going.
We also have made a real commitment to having family and youth partnership as part of the executive team, and we have Ebony as a Family and Youth Partnership Director. She is a peer to all of the program directors. With her lived experience, she is a strong advocate at the executive team. We also have a youth advocate who sits on the executive team, is part of every meeting once a week, and part of our leadership team, provides feedback and a perspective from the youth point of view. And then we have mentor parents. Our foster parents have been involved in hiring directors. They've been on the interview team. They also mentor other foster parents and are primary recruiters for other foster parents as we build that foster care component. We also have both a support group for youth and families, and we have a resiliency leadership academy for young people who've been within the organizations and served, and also young people who've graduated and come back and still stay engaged, where they build skills, they provide feedback on what they want to learn and how they need support in the work they're doing as they become adults.
Thank you for that. That's very helpful. And I'll open it up now for questions in the chat box, and we can open up the lines too, if that's helpful for people just to ask that verbally. Do we want to do that?
If everybody would please make sure that your computer speakers are muted if you're listening by the phone. It'll prevent feedback. I'm going to unmute the phones now.
And we'll take questions. And while he's doing that, I had, Laura, could you speak a little bit to the additional audiences that you direct some of your outcome data to, aside from staff within the organization, and how that's helpful, you know, how having this data readily available is helpful to other outside entities, whoever those are?
Absolutely. Well, one key component is whatever data we're presenting to our staff also gets presented to our board, and they have our full reports. And then we also have regular outcome data discussions with our partners in the community, whether it's probation, child welfare, or mental health, and those are ongoing. But legislatively, our outcome data has been really critically important in moving the state to a really more focused. We have continuum of care reform going on here, and that is based on the outcomes provided by providers like us. We present at assembly hearings and Senate hearings on the data and what works for us, what's been effective, and what has not been effective. We also have, obviously, our annual report. We post our data on our website. So at a lot of different levels, the data is utilized. And then even our families are part of, they know how the results are, but they also share their personal stories, not just with us, but with the system partners through the Family and Youth Panel.
Excellent. Thank you for that. I think that's helpful, and it certainly adds a tone of credibility when families are presenting some of that data as well to particular audiences. So I'll pause and let anyone chime in and ask a question at this time. I'll mention, too, that for this particular audience in Texas, that there is a lot of work that has been done in the area of wraparound, and they have worked with the National Wraparound Center in implementing wraparound, especially with the 1915C waiver. And marrying, in efforts of marrying that up with young people that need residential intervention as well across the state. So wraparound, especially high quality wraparound, is being implemented around Texas. Is there any other advice that you would offer with regards to that, as far as wraparound as an approach to that service, that high level of service coordination and using outcomes in that context?
So we do utilize wraparound as a transition point for youth from residential treatment or group homes, actually nationwide, because some of our youth are outside of California, and we will actually visit the youth before they come home. That component is not actually reimbursed, but it is critically important, that 30-day transition before a young person comes home. And with that, wraparound actually has been very effective in reunifying families and ensuring stability over time. We look at our wraparound data across right now across the county, so all of the wraparound providers compare their data. Right now, we've continuously had the strongest outcomes in permanency for that particular population, and I think part of it is, there's a lot of different things. One is we use high fidelity wraparound. We also really emphasize the family and youth voice as the center of the planning, the child family teaming, and across the implementation. One of the things I did want to mention, Sherri, is that BBI has a great resource on measuring impact that you can utilize if you're wondering what measures to utilize for impact. And BBI has a lot of other resources that are particularly of help for folks that are running residential or doing some transformational work back into the community.
Thank you for that. And I'll just invite, if there's anything else that you wanted to speak to about working with children in foster care. And then I know that the thing that comes up frequently, especially when we're talking about residential interventions, are locating family to work with, and that kind of skirts into the area of family find and engage. But with if there's anything, I just wanted to make sure that Melissa's question was addressed, and I know that you talked about it earlier. If there's anything additional you wanted to say.
I think just really embedding that into each program that we offer. So all of our staff, regardless of whether they're working in foster care or wraparound or outpatient mental health, all receive the family finding training and know the steps to take. So we look at family engagement and the searching as a part of the continuum. And what that means is that within 30 days of beginning services, if there's even only just one family member that's been identified, we know that we need to increase that number exponentially, really, for the family to be successful. And so we have it's actually written into our policy and procedure that within those 30 days, a connection map and family tree is one of the outputs for any youth and family that's being served within our organization. And that helps us to know where the need is and to start the process for starting to have those discussions with families, talk with our county partners, and get all on the same page so that we can really ensure that our youth and families have as many connections as possible. And so just, I think, highlighting again that family and youth partnership really being a part of that process, being the first initial points of contact, but also really being persistent, one of our values, in following up with the families and making sure that they have the tools that they need when we're first starting that outreach so that they can stay engaged and really feel like they're an important part of this process.
one piece is that a family may initially, the county worker, social worker may say, oh no, that family member is not appropriate. We don't stop at that. We really focus on advocating and ensuring that there is a really recent, current assessment of safety and advocacy. We've also had young people identified as not being able to live in a family, which we also advocate on behalf of the young people. We had one young person transition. He was in the detention center, almost 18, and we had a foster family who wanted to take him in and who was highly skilled. And we actually went up the chain to the probation, the head of probation and the head of child welfare, who advocated for that young person to go into a family, and he was very, very successful. So we don't give up on any children, we don't give up on any family, and that's critically important. We do recognize that not every family is in a place where they can take a youth in, but we will find somebody that's connected and that young person is identified. So it may be a teacher, or it may be a coach that's connected and has been connected to that young person for a long, long time, but it is somebody that young person feels connected to, not necessarily a stranger. So that is our priority, is to find family, and our reunification is actually our greatest success rate in the organization.
Thank you, Ebony and Laura, for that. And to Laura's point, I would point you to the Building Bridges, the #4 youth website. And at the top, there's a tab that says products, and then you go over to tools on the left-hand side, and about the 8th bullet down, I know I'm giving, but it's the navigation, but about the 8th bullet down is a guide for finding and engaging families and youth receiving residential interventions, and there's other tip sheets and resources for family and youth on the website that hopefully, I know I've heard from other folks that they've said that it's found very helpful. Thank you, Laura and Ebony. Really appreciate you sharing your journey and your expertise with really addressing outcomes and results and the resources that you shared. And look forward to everyone taking this information and going forward. I know we have a training at the end of January in Texas, in Houston, that will continue this conversation around best practices for transforming with residential interventions. So thank you all, and everyone have a great week.
Thank you.
Thank you.